Hi, I'm Mike Marshall. I'm the Healthy Living Editor at the Dallas Morning News and dallasnews.com. With me is Dr. Jane Sadler of Baylor Scott and White Garland. She is a blogger for the Dallas Morning News and dallasnews.com. Dr. Jane, you and I have something in common. We are both sending kids off to college this fall, and you think it's a good idea for every college student to have a first aid kit.
I want every college student to be prepared for any minor emergencies that may occur in their dorm room or on the college campus, for which they really don't need to go to the student medical center to be taken care of. So you want them to be taken care of close to their little area of security.
Well, you have prepared a sample kit for us that a student could take, and I was wondering if you could lead us through what you're suggesting that everyone should pack.
Now, this is a sample kit,
Okay.
and this is not what is for everybody. There are some kids who have certain medical needs, such as asthma or an allergy reaction, say to insects, that may require additional medications. So you may have to review some of this with your own doctor. But these are the basic medical needs of a college student in the dormitory.
Okay.
All right.
What do we have?
Well, let's get started. Well, the first thing you want is something to absorb a wound if you break the skin. And so any kind of absorbent package of gauze is recommended. This is great. You apply direct pressure. It'll help stop wound bleeding. The next thing are 15 adhesive bandages. Now, these are simple Band-Aids that I've placed in a baggie for my child. I've added small bandages, large bandages, even some blister bandages, because you never know, with all the walking, they're sure to get blisters on their feet. Next, we include antibiotic packs. Now, I keep a little antibiotic in her baggie at all times, and this will include for her just a big tube. Now, what you can do is you can get small packets as well. And actually, I do include these in a mobile kit that she carries with her in her backpack. So there are small antibiotic packs here.
Okay.
The other thing that I really recommend for students who travel, who have a car, is always carry a blanket in your car. You never know if you're going to have your car maybe stopped in cold weather, and it's very, very important if you're traveling to have a blanket.
Okay, it doesn't have to have a Duke Blue Devil
It doesn't have to have a blue
That's good, because some of us might have a problem with that.
Some people bleed maroon. All right. So the next thing that all college students should have in their dormitory are a pair of non-latex gloves. And I include several pairs. And this is if you're dealing with someone else's wound and assisting them put on a pair of gloves to protect yourself. And the other important inclusion in any medical kit are bandage scissors. These are useful when you're securing bandages that have to be fit specifically for a body part. So these are important also in removing bandages once they've been placed.
And that's specifically for bandages. You're not encouraging anyone to actually do surgery in the dorm room.
There is no surgery to
Okay, just making sure.
No. All right. And the other important medication, other than the antibiotic, is a cortisone cream. This is great for insect bites. This is great for rashes. It's applied on the skin. And any rash that doesn't go away or gets worse, the child or young adult should notify their doctor or their parent as soon as possible. I've also included Benadryl. This, along with the cortisone, are really good for rashes. And again, the Benadryl is a pill, it's a tablet, it can make them drowsy. They need to be careful. But taking one Benadryl for a rash or for itching is very, very helpful. And then roller bandages. I love these. I place bandages, gauze bandages underneath these if you have a wound on your leg or your arm, and then wrap the bandage around that body part, because those are places where bandages commonly fall off. And you can do that with regular bandages, or you can buy a material called Cobam, but it is not reusable. The nice aspect of an ACE bandage is it is reusable. And then 3 to 5 sterile gauze pads. And these are what I usually place underneath the ACE bandage. And these are sterile gauze. They can be placed directly on a wound. Thermometer is always important. This is a simple under-the-tongue thermometer. But a temporal thermometer works quicker and faster, but it's far more expensive. This is very simple. And then tweezers. Everyone gets splinters in college. So fine-tipped tweezers are important to help take out those splinters. You might even include a little magnifying glass if you need it. So these are basic products that I recommend for a first aid kit. They need to go in a small kit because there's no room in a dormitory for anything.
That's true.
And so I recommend a small kit, and I also recommend a small mobile kit that they can just stick in their backpack.
Okay.
And that's about it.
Wonderful. Well, I sincerely hope that neither of our kids has any call for any of this this fall, but if they do, it's good to know they can be prepared. So.
And they can always get on their cell phone and call Dr. Mom or Dr. Dad.
Thank you so much. You can read Dr. Jane at the health blog at dallasnews.com and regularly in the print edition of the Dallas Morning News. Thank you very much.